Gill, we've heard various media contributions over recent months arguing for the regulation of healthcare assistants. Could you outline for us why there is this call for regulation and the benefits it might bring to patients?
I think the concern stems from the fact that the general public and the profession to a degree, and I think you'll get a mixed review within the profession, is that if individuals' practice is regulated, therefore it will be good. I don't believe that necessarily follows, but I think that's what is driving the need and the desire to have healthcare support workers regulated.
In central Manchester, you've got clinical support workers and you also have assistant practitioners. We heard today there's something like 121 different job titles for people who support registered professionals. Does it matter, these different job titles? Is there a case for having greater consistency across the NHS?
I think there is. I think there is a case for having greater consistency. I think people are confused about who is a nurse, what is a nurse. I think people are confused about what nurses do. I think we need to be quite clear and quite explicit for patients and their relatives and for other professional staff just what people are there to do. And I think it's helpful if you go on a ward and you speak to a staff nurse, then by and large you know what that staff nurse can do within their job description, their roles and responsibilities. It's much more difficult with healthcare assistant, support worker, etc. And I think a universal title would be the first step along that path. But the real critical factor is training, and they need to be trained consistently and deemed competent to undertake the duties that we wish them to do.
You said that you weren't in favour of formal regulation of healthcare assistants, or whatever you decide to call them. Would you be supportive of some national competences and accredited training?
Absolutely, definitely. My worry with regulation is that it's seen as some sort of panacea that will solve a problem, when the reality is about training and competency and assessment and variation. So if there was such a thing existed as a national programme, then I would be very supportive of that, yes.
The Nursing and Midwifery Council holds nurses and midwives to account for delegating effectively to support them in their tasks. Is this a sufficient safeguard for patients, or should additional safeguards be introduced?
I think in themselves they are sufficient, but they're only sufficient in as much as they are exercised. And we do need to be clear that we have to hold members of staff to account. And that, whilst it sits with the NMC in terms of our registration, our regulation, it's still the role of the employer and the employing authority that it's their responsibility to ensure that their staff are held to account. And that's not just within the acute sector, but both in community and in the patient's own home.
How do regulators and boards know if they've got a safe staffing skill mix? Do they have to wait till the patient safety indicators go off the scale before they know? Or are there other methods?
I think it's very difficult. I don't think one size fits all, and I think there is a difficulty in trying to impose those sorts of solutions on organisations. Ideally, organisations should have some sort of indicator that they use internally, and that can be a whole range of things, from very hard indicators, which are, you know, the number of falls, the number of pressure ulcers, etc., that might occur on a patient or in a ward at any one time. It's also other intelligence that you would gather, such as complaints, you know, verbal, non-verbal, written, patient experience, what people post on websites. There's a whole range of knowing how you're doing, and the important thing is that you collect that and you take notice of it and you take action as a result of it.
Sounds very complicated. How do you know which one of those measures can be linked back to the skill mix?
I think it's quite difficult, really, and I mean, people trying to make it scientific, and to a degree you can. There are dependency tools that you can use to judge acuity and dependency of patients, but equally I think there's also something about the leadership of the ward manager and their professional judgment on what is right for their ward, and to allow them the flexibility to change the skill mix if the case mix changes, and we as professionals have got to be responsive to that. So it's not one size fits all. It is quite complicated, but we're working in a highly complicated and highly risky environment, so it's not that easy.
We've had a lot of discussion this morning about the role of the ward managers, ward sisters. Are there changes that you think that trusts should consider to strengthen that role?
One of the things we did when I came into post about 10 years ago was to ask the ward managers exactly what would make a difference for them to enable them to deliver the job that we felt they needed to do in the ward environment. And they were very clear to us that the two most important things were to put them back into navy blue, because they'd gone into a grey, very anonymous uniform, which they didn't like, and certainly was not easy for staff or carers or patients to identify with. So we did that, and they also asked to be made supernumerary. So over the last 10 years we've now released our ward managers so that they are supernumerary, and we've also supported them with action learning sets, and we've paid for them to do managerial courses, etc., and we've had them shadowing, etc., etc., senior nurses across the organisation. And we're now at a stage where it's my view as a chief nurse that we have a reasonable expectation of those ward managers now to deliver the professional agenda, and that means delivering the care that's required to the standard that's required within the budget that's available. And that's not an easy task, but nevertheless that's the one that we think we've coached and we've encouraged them to do.
Gill, thank you very much for sharing your personal perspective and some examples from your trust.
Thank you.